Hi guys, what is healthcare business analysis? You might be wondering how healthcare is connected to the business analyst. If you're working on any domain specific project, client will be expecting minimum domain skills because they will be communicating in that particular language. But irrespective of the domain, you will be responsible for a range of activities in full system development life cycle, which improves the operational efficiency and success of the project. So if you have any plans to work with healthcare clients exclusively with health insurance companies, it is good to have knowledge on medical terminology or medical billing, which will help you to understand and communicate with subject matter experts. All the healthcare projects are controlled or managed by the CMS and they are protected by the HIPAA law. HIPAA is Health Insurance Portability and Accountability Act. It is a law to protect medical records and other personal health information while processing or adjudicating the claims. CMS, Center for Medicare and Medicaid Services, it is a federal agency within the United States. They run Medicare and Medicaid programs. Medicare is a federal program and Medicaid is a state administrated federal program. You should have some knowledge on commercial plans, which varies from state to state. For instance, out of many, HMO, PPO, EPO are considered as commercial plans or benefits for them. And we are the customers who buy the desired benefits or plans. So as a BA, we are responsible for gathering requirements to build these plans, and we need several data elements which are required to capture from stakeholders or subject matter expert via number of meetings. One of the high priority project for any healthcare client is claim adjudication process or claim management system. You should know how claims get processed. In general, claims are nothing more than the bill submitted by the doctors or the hospitals for the treatment done to the patients. So in other words, health insurance receive the claims from the providers. It could be paper claims via UBO4 or CMS 1500 forms, or electronic claims. It could be EDI transactions 837I or 837P. And claim management system receives these claims. And claim examiner is responsible for validating this data. If there is a problem like a spelling mistakes or missing information, the claim may get denied or pended. And providers are required to resubmit the claims. It is required to understand the differences between the 4010 and the 5010 or ICD-9 and ICD-10 to define the requirements so that all the data attributes on the claims should be as per the CMS regulations. If claim contains valid data, all is fine. Providers will get paid, as simple as that. But in any case, if the claim has invalid data, the claim will get denied. So in addition to that, you should know the differences between the providers who are participating providers or non-participating providers, such as PCPs, specialists, or hospitals or home healths, or it could be even the in-network or out-of-network providers. You should identify the differences between the payments or the medical billing, which has co-pays, premiums, deductibles, co-insurance or out-of-pocket or any other payment types. You should have medical knowledge to identify the difference between the valid values or codes. It could be a bill types, diagnosis codes, procedure codes, or revenue codes, or place of service or type of bills. You need to understand you should be able to read the EDI transactions. Out of many, 837, 834, 278 are very, very important for any healthcare projects. So as a business analyst, your major role is to understand the medical knowledge, medical terminology or medical billing, which will help you to identify the business needs from the stakeholders or the subject matter experts to document the requirements. You need to develop the roadmaps with the HIPAA regulations to improve the efficiency and effectiveness of the data processing or the storage or the security, and more important, the privacy. Personally, I believe that healthcare domain is the most challenging sector, and your knowledge will help the developers to understand the requirements. I know guys, I have presented very limited subject on the healthcare, but it may help you to kickstart your profession on healthcare. Thank you and good luck.